Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Today we're going to be talking about something that, seems to be on the horizon and almost in common language as you tune into television or even listen on radio. And that is the dreaded prostate cancer. That's right. Definitely men who are over the age of 40 years old should be taking a look as to whether or not they have anything that may even resemble something that can be very, 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 very deadly, to say the least. On the program today, we're going to be talking with nationally esteemed medical practitioner and a researcher, leading expert on prostate cancer, as well as prescription medications and natural supplements, and he also was diagnosed with prostate cancer in 2011. Decided to find ways that we can see if we can get tested better and more thorough, because about 15%, accordingly, of men who are diagnosed with prostate cancer get surgery or radiation, but yet only 15% actually need it. We're going to find out a little bit more what's going on here today. I'd like to welcome author of the book, Prostate Cancer Breakthroughs. It's a step-by-step guide to cutting-edge diagnostic tests and 8 medically proven treatments. I'd like to welcome to the Beyond 50 radio program today our guest, Dr. Jay Cohen. Jay, how are you today?
I'm excellent. How are you?
Doing very, very well here. You know, a book something like this you would think would be bigger than your book actually is. But it certainly doesn't lack for detail.
Well, I wrote it as I was going through the system and learned about the new possibilities, which I did not learn from my doctors at all. Mm-hmm. And yet these possibilities are available to people now, and it completely changed the course of your treatment and the knowledge base by which you make treatment decisions. But I wrote it to be a pretty quick read. Step 1, PSA testing. Should you get it? Should you not? If it's high, what does it mean? It doesn't always mean cancer, and yet doctors often react as if it is, and that's why there's such high rates of overtreatment, too much surgery, too much radiation therapy, and devastating, often lifelong impact on men's sexual functioning and bladder control. The newest statistic I have is that of the 50,000 men a year who get prostate removal surgery, also known as prostatectomy or radical prostatectomy, of the 50,000, 40,000 don't need it. And the reason for this statistic, and the same pretty much with radiation therapy, is we now have new tests that men can get to tell them for the first time exactly what they have, where they have it, and we're finding that on the old model, which is still what most doctors use, it leads to a decision for surgery or radiation of the whole prostate that now that we can see the cancer in the prostate isn't really necessary.
Now, that's what I found really interesting about as you start to read through prostate cancer is I see the same consistent thing as I talk with people, for instance, about other forms of cancer or even disease treatment, is that especially here in the United States, we seem to really be, I guess, in the dark ages when it comes to not only, the testing of, for instance, a condition, but also how we're quick to jump on the same consistent types of invasive treatments. And most of the time, they have very little success when they do work. And even when they do work, there's a recurrence or a remission of the reason that you went in there for in the first place. And yet you take a look at strategies, for instance, perhaps in Europe or, even in India, for instance, and you see remarkable turnarounds in their whole approach to this, a more holistic approach, if you will. And I'd like to know from your point of view, because you're a doctor, what do you think is going on here that we seem to just not want to crawl out of the dark ages when it comes to something like this?
Well, as an integrative doctor, which means I take the best from mainstream medicine, and there's a lot that's good, and I take the best from alternative medicine. I was with the first team in America to do real studies on acupuncture when we learned about it after Nixon's visit in 1973, visit to China. And I've always been interested in a lot of different things. And mainstream medicine here has been kind of at a disadvantage. Up until now, we really haven't had good tools to really diagnose what a man with prostate cancer is dealing with. We haven't been able to actually see the cancer. Think about this. We've never been able to do an MRI of the prostate because it's so deep in the pelvis, and we didn't have the technology to separate cancer cells from normal cells. But imagine having surgery on your shoulder or your knee or your brain or your abdomen without an MRI. Well, they've been available for a couple decades now. But with prostate cancer, if your PSA is high, if your biopsy shows even a little bit of cancer, it's surgery or radiation, because they've been so afraid of missing a cancer, then a man would get metastases and have a long, slow, painful death. So they've bent over backwards not to miss one, but in doing so, they've bent over so far, as was going to happen to me. I was on the surgery schedule. I had a high PSA. I had some positive biopsies for cancer, and that meant surgery or radiation. I spoke to 4 surgeons, and up until now, there hasn't been the ability to really differentiate who really needs it and who doesn't. That's why I wanted to get the word out on a number of things, especially this new prostate-specific MRI I talk about. It's not available everywhere. Most hospitals don't have the technology. It requires a big, expensive, what we call Tesla 3.0 powerful magnifier. But it is available at about 8 to 10 leading medical institutions, the top places. Mayo Clinic, MD Anderson, Sloan Kettering, UCLA, and a bunch of others. But most doctors don't know about it. Most doctors don't tell their patients about it. They don't go and get the MRI, as I luckily heard about and did, so they don't know really what they're treating. Doctors will say to patients, and you remember the urologists are the ones who handle this, and they're surgeons, and they'll say, well, if you have prostate cancer in one place, you have it everywhere. We've proven that. Well, in fact, while I'm kind of debating this with myself under a lot of stress, a study comes out done at the Cleveland Clinic, this is just a year ago, and it shows they took men who they had found by biopsy, it showed cancer on one side of the prostate. And of course, they were all told, well, you have it everywhere, so let's remove it all. They took the prostate glands to the pathology lab, and they looked, and they found that that wasn't true. In 71% of the men, there was no significant cancer anywhere else. So I went ahead and got my MRI, and again, I'm being told your PSA is really high. We've got 3 cores where we found cancer in your biopsy cores of your 14. That means surgery or radiation. Well, we did the MRI. I went all the way. I live in San Diego. I drove up to UCLA and got this new prostate MRI, and it showed that the biopsy that found the cancer on the left side, that's all there was. It was just on the left side in one particular area, kind of a small, medium size, non-aggressive grade, but most of all, it wasn't anywhere else. It was an area in the prostate that was kind of in the middle of nowhere. It wasn't encroaching on any major structures. It wasn't looking like it was spreading. And I got some more opinions. I probably spoke to about 15 doctors overall about the different possibilities. And basically I chose to work with an oncologist who specializes in prostate cancer only. And we agreed that we would just keep an eye on it, because now that you can watch it and see, if there are changes pretty quickly, it gives you real breathing space that we know previously did not have.
Now, as you describe in your book, urologists perform, apparently, when it comes to biopsies, 1.2 million prostate biopsies each year.
Right.
And as you state, about 600,000 too many. Now, that's a pretty big number. It'd be different if it was about 10, maybe 15,000, which is still a big number, but 600,000, you're looking at half. 50% of these just don't need to be done.
That's right. Let me run some other statistics by you, just so the listeners know what we're dealing with here.
Not to mention listeners love statistics.
Oh, good. I'll make them very happy without overdoing it, hopefully. First of all, prostate cancer is, other than minor skin cancers, prostate cancer is the most common cancer in men. 240,000 will be diagnosed this year. Second, it is the second most lethal cancer among men, lung cancer being first, prostate cancer killing 30,000 U.S. men a year and 280,000 men around the world a year. Prostate cancer in men, the statistics are quite similar to the statistics for breast cancer in women. About the same number die a year from breast cancer. If you look around and think of all the men in your life, from your family, your parent, your father, your children, maybe male children, brothers, friends, co-workers, favorite singers, favorite athletes, favorite politicians, least favorite politicians, 1 in every 6 of those men will be diagnosed with prostate cancer sometime in their life. Now, talking about biopsies, biopsies are important. I don't say don't do them, but a lot of experts in this field have said we do way too many. The biopsy is a medical procedure. It's a surgical procedure. They insert the biopsy needles, probes, through the rectum, and infection can occur. I have a friend, a doctor, who ended up with a severe blood infection, was hospitalized for 10 days. They had to try like 3 different antibiotics till they found one that worked, but meanwhile he kept getting worse and worse and worse until they did. So, it's not a huge deal. It's like a breast biopsy, but it's not something you want to be doing if you don't really need to do it. So the key to this, and I'll tell you how the technology is moving forward, although it hasn't reached your doctor's office yet, but again, at the major medical centers, they're not only using this new MRI I talked about, they're using the MRI as they do the biopsy, because first of all, if in an MRI there's no sign on the MRI that there's any areas to be concerned about, they can skip the biopsy. They can just wait and see and repeat the tests over time. Second, if there are concerns about cancer, high PSA, etc., they can then use the MRI and use it to tell the doctor, as they're doing the MRI, where to actually direct his probes. We call this the modern targeted MRI. Right now targeted biopsy. Right now we do biopsies, we just take pieces here and here and here and here. But now that we can see what we're aiming for, we can, 1, get more biopsy pieces in the areas we're concerned about, do less in other areas, and overall do less, which reduces the likelihood of trauma or infection.
Now, again, it's pretty amazing because there's usually a standard test, which is a blood test that they take. And generally based on the numbers of that blood test, doesn't it seem like a lot of doctors kind of jump the gun and say, we just need to go into surgery and this is just common protocol?
Well, yes, that's one of the big problems. Most of your listeners may have heard over the last few months that there's been a big controversy. Should we continue this PSA testing? The PSA stands for prostate-specific antigen, and it's a small protein that the prostate releases under normal conditions in small amounts in the bloodstream. It's made by prostate cells. But prostate cancer cells are more overactive metabolically, and they release more. So if a man has been getting a PSA test over the years and suddenly it jumps, that's a warning sign. But like one of my support group cohorts says, he says the PSA, when it goes up unexpectedly, is like your engine light going on in your car. It means there might be a problem, but you don't know really specifically what it means, because the PSA elevation doesn't always mean cancer. It can mean other things. And in the first couple of chapters of the book, I talk about PSA and how to look at it. And I also tell men, and actually I wrote it also for women, because women are the health readers. So I wrote it, really, a lot of detail, a lot of information, but a quick read of 110 pages. But in the first chapter, I arm the reader with, it could also mean the prostate is larger. As men's prostates get larger, most men as they get older, it secretes more PSA, so a gradual elevation may be just part of that. Doctors should actually measure the size of the prostate, and they actually don't most of the time until they're on the way to biopsy. But an elevated prostate can elevate the PSA. The PSA can also be elevated if there's an infection or there's been a history of previous prostate infections. A PSA can be elevated if a man has had an orgasm within the prior 24 to 48 hours, because with that muscular contractions, there's an extra release of PSA material. And finally, if the man is an avid bike rider or an exercise bike rider, sitting on a bicycle seat for a while pushes on that perineum area right down below, and it pushes on the prostate and can sometimes squeeze out a little more PSA material. So all these things should be checked, and if any of them might be an issue, for example, if there's an infection, the man could take antibiotics for a few weeks and then repeat the PSA. So the important thing is that the doctor tell men that. My doctor's never told me that, by the way. Most doctors, I don't think, even know about this. And repeat the PSA before the man's pushed down the assembly line to biopsy and then possibly to extreme treatments.
Now, is there a reason, just quickly, that they tend to push men in this direction for the kinds of treatments that they push them towards that a lot of times can relatively be unnecessary?
Well, let me talk about treatment for a moment, because yes, the treatments have been either radical surgery with all of its long-term impacts on many, many men's lives, tens of thousands of men's lives. Radiation of the whole area. They don't radiate one little area, they radiate the whole area with similar impacts, or nothing, which they called watchful waiting, which meant we'll watch and wait, because they had no tools. Now, most men don't want to sit around knowing they have cancer in the prostate and just watch and wait and see if they live or die. And that's why I signed up for surgery, because as far as I was concerned, that's all there was.
Mm-hmm.
But what I learned, really just so luckily, is that now as this new technology is coming on board and is available, all the choices open up. For example, once I had that MRI that showed what I had, and it showed that it wasn't a high-risk cancer, and it showed that it wasn't in any important areas, and that it didn't show any signs of spread or encroachment, I had other possibilities. I thought, well, if I decide to get it out, do I have to do a whole radical prostatectomy? And the answer is no, because we also have focal therapies. Kind of the way women get lumpectomies.
Mm-hmm.
Well, we have what's called a high-intensity focused ultrasound, which is basically burns the cancer, and it's done under MRI. We have a cryosurgery, which is a freezing of the cancer done under MRI. And now we have clinical studies that people can go and sign up for right now, what's called focal laser ablation. And they use MRI as they're doing it, and they put the probe right into the cancer area, and they burn it with laser heat, generated heat, and they watch the MRI, and they can actually see the tissue of the cancer and of the area all around it for extra measure to make sure that the laser was effective in burning the cells. So those are also possibilities. And then finally, we have what's called active surveillance. Instead of watchful waiting, where you watch and wait, active surveillance, which is what I am doing, means you continue your PSA testing every 3 months. My doctor does a test, a diagnostic test called color Doppler ultrasound. Only about maybe 30 or so doctors in America do it, but it's an office procedure where with an ultrasound probe, they can actually see the cancer. And again, it's another way to, one, watch the cancer, identify its location, and watch for any change. And it's also used for, again, like MRI, for targeting the biopsy. So we do that every 6 months, and then I do the MRI every year. And so far, it's been, I guess, about a year and a half. and so far so good. Everything's remained steady. Chances are 2 to 1 that I will never need treatment of this low-grade cancer of mine. And if there are any sign that I should need treatment, my PSA jumps higher, or something like signs of change in the cancer area, then I would go ahead with one of the local, focal treatments I mentioned just now.
Now, when it's caught early, this is something that's pretty treatable, isn't it?
Well, that's why doing the PSA is so important. Every expert I've spoken to, we may disagree on other points, they all agree that this thing about stop doing PSA testing that the government has facilitated and the organizations, the medical organizations have gotten behind, don't do it, is insane. Mm-hmm. Because if you catch it early, if we can teach doctors not to overreact and shove men down the chute to aggressive treatment, the PSA is the early warning sign. And today, if you can catch this cancer early, even an aggressive cancer, you can cure or at least keep this cancer at bay for a decade, 2 decades, the rest of a man's life. The odds are excellent if we catch it early.
Now, does this seem to be something, prostate cancer that has increased, I guess, in visibility? Has it always been around, or is it because of our population growing that we see more and more of it?
I think we see more and more of it. I think the main reason is men live older and older, and the older we get, they say that a man, at 70% of men have prostate cancer. Most of it is small and really not a threat. At 90% of men have prostate cancer, and that's why they want to kind of slow down doctors from over-treating these things, because we're learning that a lot of these things don't need treatment, they just need observation. But it's always been there. Then the alternative folks say, well, yeah, but what about diet we have and the environment we have? Well, certainly we know that, high-fat diets, saturated fat diets, high-sugar diets do seem to increase the risk of prostate cancer. But still that doesn't mean it's all or nothing. I've been a vegetarian for a very long time. I always, I exercise. I take pretty good care of myself, and I got it. So, it's not an all or nothing thing, but I think the better you take care of yourself, the healthier you eat, the better your odds as far as getting, a cancer. And my cancer is not a particularly aggressive cancer, so I don't know if that has to do with my diet or my other health actions, but I knock wood for that.
Now, it's really fascinating because your approach in your book, Prostate Cancer Breakthroughs, makes a lot of sense. It's just as you said just a few minutes ago, is that it's getting doctors to slow down and just don't flip out over this and rush into a decision such as surgery or radiation. That just makes a lot of sense anyway. Sort of like when there's a fire in the kitchen. You don't go crazy and grab a bucket of water and throw it at it. You take a moment if you can, take a look at the situation and find the best course of action, really. And usually, once you do that, you make better decisions anyway.
Well, that is the most important aspect of the message I'm trying to get out there. Mm-hmm. The message being we have these new tests, we have these new choices of treatment, but prostate cancer, in most cases, is not fast-moving, it's slow-moving. Okay. So most men have time to check all these things out. Now, the problem is that the word cancer has a bit of a charge to it, to say the least.
Like shark.
Like shark, and more. But, having been told I have cancer, it certainly daunted me and affected my sleep, and your brain starts working it. And a lot of men, with encouragement from their doctors, kind of just get to the point where they say, well, let's just cut it out. Let's get rid of it. Or let's just fry it with the radiation. And they just want to get it over with and deal with it and move on. The problem is that those treatments and their impact on life, some men don't move on from. But the other is there's time in most cases, in 99% of cases, there really is time to get second opinions, to go online and do the research about these tests I've spoken about and about the treatments I've described. So, even if men take a week or two to get some other opinions, I ultimately got about 14 opinions. I don't recommend that to everybody, but in the book I try to guide readers to how to do these things and how to get information. You can go online to some of these medical centers and see what they have to say about some of the things I'm talking about. In the book, I quote top authorities. In fact, there's a top urology doctor named Peter Scardino at Sloan Kettering Cancer Center in New York. Certainly one of the very top respected urologists. He's done, they say, like 1,500 prostate surgeries and all. But, I quote him because he says, yes, we use this modern MRI. We just are trying to make sure whether this person has a big aggressive cancer or not. We do the PSA testing. We do, the biopsy. We do the rectal exam, the digital rectal exam by the doctor. And we do the MRI, and we just put it all together and see where we are. And then, the patient and we make decisions together as what's the most appropriate treatment for that particular man. So the message of the book is, here's what's available. Here are the studies, the top studies. Here are the top leaders all saying the same thing. Like you said earlier, the key is for the medical system for it to trickle down faster, because it's going to take 5 to 10 years because things change so slowly. So the more important aspect is for the reader, for the man, for the woman, who are impacted with this kind of diagnosis, get the information, have the tools to find the people that can discuss these possibilities with them and make decisions about treatment.
You were alluding to earlier government agency, which, is kind of getting in the way, and this is the U.S. Preventive Services Task Force.
Yes.
Okay. And they issued apparently a directive to discontinue PSA testing in men. Now, I don't know. There's all this, screaming and fist pumping about Obamacare, but is this kind of one of the outcroppings of what everybody is complaining about?
Well, I don't think it
has
anything to do with Obamacare.
Okay. No, and I wasn't trying to tie it to that, but the point is one of the arguments that I hear pretty regularly now is the limitations that people seem to have, first of all, forcing them to go out and buy insurance. But once you're kind of in that, I guess, environment with insurance, is it relatively difficult for people to follow the kinds of protocols that you have when it comes to something like, for instance, diagnosing prostate cancer?
Well, I think if you find the right doctor, the doctor will recommend the things and give suitable orders.
Mm-hmm.
I know when I got that, and I got my MRI at UCLA, I had been on Medicare a couple of years, and they covered it. Now, my first MRI, which was done 8 months earlier when I was right on the cusp of deciding about surgery, I was at Kaiser then, and I said to my Kaiser urologist, who was a very experienced man, and he was very cordial to me, and he did a good biopsy and all. I said, well, why don't we get this MRI I've heard about? He said, no, they're not ready. They're not reliable. And I did some looking at some of the things online and some of the studies. In fact, it's like 85% reliable, which is pretty darn good. I mean, surgery is only 85% reliable to cure you, so we're not dealing with 100% situations in any of this. So I said, well, why don't we get it, and if it doesn't look like it's usable or helpful, we can put it aside. And he refused. And I said, well, would you please just write me a prescription? I'll go out of Kaiser system. I'll go get it at another hospital here that has something like this, and I'll pay for it out of pocket. And he refused to write me a prescription. So that may be a barrier. And I did. I got other opinions after that. But I did get my primary care doctor to write me a prescription for it. I did pay out of pocket. That was a year and a half ago. It was $550, which I thought was a bargain, considering it completely rescued me from having surgery I really did not need. Mm-hmm. And I don't think it's an extremely expensive procedure, but like I said, the second one I had, at UCLA, my Medicare and supplemental covered it pretty well.
Yeah, I wanted to bring that up because a lot of times people tend to make decisions, both doctor, obviously, as well as patient, based on the limitations of coverage they may have. And a lot of times people believe that really is the only way to go about something, when in fact, just as you did, you stepped outside of the environment of, for instance, Kaiser, and you decided to explore this on your own. And I think a lot of times, a lot of decisions about procedure when it comes to treatment, people really don't step outside and do more research or discover that they are personally empowered, for instance, to do exactly what you did. And that's what I found, encouraging about what you wrote here in your book, Prostate Cancer, is take, charge of this and, and go out there and do what you can before rushing in and just following typical protocol, which, as you state, can leave a man, for instance, somewhat devastated when they go down that road of serious surgery or radiation.
Yeah, and I wrote the book, all of my writings, this is my 10th book, and if you go to Amazon, and by the way, the book isn't in bookstores yet, it's just at Amazon, so that's where you can see it and learn all about the book. But all my books are at Amazon, and if you look at them, they're either on one of two topics, but they're all founded on my early and continued interest in improving the medical system. One is reducing the very high incidence of medication side effects and deaths a year. This is at the drug doses that doctors are told to prescribe, 150,000 deaths a year, 2 million hospitalizations. So my background in pharmacology allowed me to write a couple books on this about why this is happening, what is the problem in the way we do research, what is the problem in the way that we choose dosages that are too strong for about 25%, 35% of the population. I see it all the time in my practice. And the other books are the next step, which is, well, if we want to avoid medication side effects, what if we could find some natural supplements that would do the job as well and more safely? So hence my more recent books on natural alternatives to statin cholesterol-lowering drugs, to high blood pressure medicines, 15 natural alternatives proven effective for treating migraine headaches in adults and in children, which is in itself a big problem. So it's always been about improving the system, giving people information, because I think people will move the system more quickly than the system will move itself. So in this book, I wrote to the informed reader, the health-conscious reader, the person who will go seek information, who wants to know more, who wants to be partially in control of their own treatment course and make decisions conjointly with their doctors. So it's written for the public, which I've always enjoyed writing for, and I think that's how we're going to save a lot of men from overtreatment, and how hopefully gradually we'll change the system.
The book is Prostate Cancer Breakthroughs, a step-by-step guide to cutting-edge diagnostic tests and 8 medically proven treatments. Our guest, Dr. Jay Cohen. Jay, if you could, for our listeners, is there a website people can find out more?
Yes, they can go to my website, which is based on my work in medication, Medication Sense, like common sense, medicationsense.com.
Very good. Thank you so much for being on the program today. Very encouraging work here, and we love to present that to our listeners that, look, you're empowered with possible options, and the first thing is educate yourself so you know that you have them in the first place. Thank you for being on the program today.
Thank you very much. I enjoyed talking to your people.
You betcha. Prostate Cancer Breakthroughs is the book. Get out there and get yourself a copy, and be sure to visit the website as well. And if you didn't get that down, go to our website at beyond50radio.blogspot.com. That is the number 50. We'll have a hot link for you. That way you can just click away and find out more. Thank you again for joining us on the program. I'm Daniel Davis. This is Beyond 50, and remember, live your day past halfway.